Hello, my name is Nancy Cullibong Smith, and I have my master's in nursing, and I'm also a certified adult nurse practitioner and a certified nephrology nurse. And I got my master's 6 years ago, and very excited to do that. I had worked as a staff nurse working with transplant patients and kidney patients, and I loved the patient education and the staff education aspects of it, and went back to school and chose to do a dual track. And what that means is I got trained to be a clinical nurse specialist, to work with systems, and as a nurse practitioner, so I could care for patients and write orders and do diagnostics and assessment. So it's a great opportunity to encompass all the things you love into one job and into one career. My current role is a blended role that I was able to create with my institution, the University of Washington Medical Center, to be a clinical nurse specialist for kidney patients and transplant patients, and a nurse practitioner who cares for blood sugar control or diabetes for patients who've had transplants. And so my role has a lot of different parts. Some of that includes education of patients who are either new to diabetes, new to transplant, new to kidney disease, and how to enhance their health and take care of themselves, and how to make choices about what treatments they want to take and how to make lifestyle changes. Some of my role is in educating nurses who are new to nursing in how to care for these very acute care patients who have organ disease, like kidney failure. I also work with our dialysis nurses and our dialysis technicians to do orientation and training so that they can provide dialysis care to all of our patients across the medical center. Some of my other roles on a system level are doing program development for our dialysis program. So that includes everything from doing quality improvement, making sure that we're safe, and going along with regulatory compliance and writing policies, as well as doing research to make sure that what we're doing and the care we're providing is up to date with whatever is the newest and most beneficial to our patients. So looking at the current evidence and adjusting our policies and our order sets and how we teach the nurses to give care so that they can give care at the best way we know how. Other parts of my job include being a resource, and that's a resource for doctors, nurses, nurse practitioners, and the patients for anything that has to do with dialysis care, transplant, or diabetes. So that could include being a vascular access resource for patients who have fistulas for dialysis and teaching them how to take care of it or better access it. That includes trying to help patients who have new kidney disease decide what type of renal replacement therapy they want to choose, whether it's transplant, peritoneal dialysis, or hemodialysis. I also help the med-surg nurses, our general staff nurses, know a little bit more about these special patient populations that they might see on their unit and not be as familiar or taking care of. As far as Pearl, something that I want to share with you, it's really the importance of the role of the nurse in caring for these patients and translating that literature into our everyday care. And that we have a rich body of knowledge and experience as nurses from being so closely working with our patients to share with other members of a multidisciplinary team, both in patient care but also in research. It's the nursing part of it that I think really touches on how we teach the patient, how we teach the nurses, looking into some of the finer detail of what we do. Bringing a holistic view to that research, and it's been so rewarding to know that we are making steps toward having more options for patients everywhere. So I hope this has been interesting for you, and thanks so much.